Awesome. Well, welcome everyone. This is the third town hall discussion panel for COVID-19 testing, vaccines, and equity. We had two previous town halls earlier this year during the earlier stages of the vaccine rollout. Some of you may have been with us then, or maybe some of you are new. But this is hosted by the Community Health Department at Lawrence Douglas County Public Health, as well as Equity Impact Advisors of Unified Command, as well as the Vaccination Unit and Surveillance Testing Unit of Unified Command. So just a little heads up about our partners in these. But my name is Alex Kimball Williams. I use she, her, they, them pronouns, and I'm one of your co-hosts along with Ruaa Hassaballa-Muhammad. We'll both take a second to introduce ourselves a little bit more in a minute. But just a couple of housekeeping remarks. Definitely try to keep your mics on mute if you can so that we can hear our panelists tonight. A lot of people are here trying to hear what they have to say and make sure that we can hear people's questions as well. So definitely keep an eye on that. Me and Ruaa being co-moderators can kind of be a little bit helpful in that if somebody were to accidentally unmute and you can't figure it out. So we'll be here to kind of save you here and there as needed. But definitely keep an eye on that. And then we are going to have a public question segment. We have done those usually in the Zoom chat. So be sure to put your questions in the Zoom chat as you have them. Be mindful of using the chat for questions only if we can, as opposed to other discussion and responses to what the panelists are saying. That way, when me and Ruaa are looking for questions to post to the panelists, or the panelists are looking at the questions, it's a little clearer to us. So use the chat for questions. And trying to think of anything else. We have an agenda for the night. Let me pull that up. We are going to jump right into the panelist discussion. In the previous town halls, we did do presentations and some other material first, but tonight we're just going to jump right into the questions. We know that you're eager. And then we're also, like I said, going to have a public Q&A for people that are here tonight. We also have a very special presentation from Equity Impact Advisors. That's the team in the county who's looking at equity issues for vaccine and testing access, financial and other budgetary decisions and things like that involved with COVID-19. They're a group of mostly women of color doing really amazing work. Myself and Ruaa are part of that group. So we're really looking forward to you getting to hear more about the efforts that the Equity Impact Advisors have been part of. We're also going to share about some really cool resources that we have in case you want to learn more information or stay updated on the local COVID-19 situation. We're going to share some resources about that, including a hub that's online that you can check and it's updated very regularly. So if you want to hang out till the end to learn more about those, definitely feel free to. We're also going to be posting these into the event page. So don't worry if you need the links or things like that. And then, of course, we're going to end with some closing remarks and anything else that the panelists would like to say, any outstanding questions if we have time to answer them, things like that. A quick note is that we are going to, we did have a submission form for questions. We are going to follow up on all the questions that we receive. Also, other questions that are in our chat tonight, especially that we don't get to, or even questions that were part of our pre-selected questions for the panel that we don't get to, we're going to be publicizing answers to that in the coming weeks. So definitely don't feel like if we don't get to your question that you're not going to hear anything about it. We're definitely cognizant of making sure that you get that information. Okay, Ruaa, is there anything else in terms of opening announcements?
I think you covered it well. Thank you.
Okay, so let's go ahead and introduce ourselves. Like I said, my name is Alex Kimball Williams. I use she, her, or they, them pronouns. I'm the health equity planner at Lawrence Douglas County Public Health. Like I mentioned before, I'm also part of the Equity Impact Advisors team. I'm part of the vaccination unit as well as their sitting equity person. And I'm also a community organizer. There's a lot more about me if you want to Google, but I do music as well. And I've really enjoyed getting to moderate these panels because these are really, really good questions. And sometimes I'm even surprised or learning things as the panelists are responding.
Thank you, Alex. Good evening, everybody. My name is Rowan Hassan, and I'm the COVID Testing Equity Project Manager for Lawrence Douglas County Public Health. I'm really excited to be co-hosting with Alex and just want to thank all the panelists. Thank you all for being here today. And we'll get started with our panelists introducing themselves. So I'll hand it off to our panelists with Dan.
Thank you, Ruaa and Alex. You're doing a great job. I'm proud to be part of this effort tonight. I'm the director at Lawrence Douglas County Public Health, and I've been in public health for 31 years. The last 14 here as the director for the department. And in that time have not experienced anything like COVID in the past. And my one kind of, I guess, piece of learning along this journey, because it's definitely a marathon and not a sprint, and is that to just kind of focus on things that you can control and then find peace for those things that are outside of your control. You know, this is as much a psychological disease as it is a physical one. And I think being mindful of what we need to do for our emotional self is important.
Thank you, Dan. Next, we got Dr. Scrimsher.
Hey, I'm Jen Scrimsher. I'm one of the infectious disease physicians at LMH Health, and I am the Deputy Public Health Officer for Lawrence Douglas County Public Health. I think I say this on pretty much every meeting that I get asked, you know, the lessons learned or whatnot is I've been overwhelmed by the collaborative and cooperative spirit of everyone involved in the region, the state, the nation. It's been amazing, and I've been extremely happy and humbled to be a part of it.
Thank you, Dr. Scrimsher. Next, we got Dr. Lewis.
Well, good evening, everyone. First of all, thank you for this opportunity to be on with you this evening, and a special shout out and kudos to the Equity Impact Advisors for their intentional work that you all are doing around managing this pandemic. I also appreciate our partnership with the Lawrence Douglas County Health Department, our local docs in the county. You know, I talk to superintendents around the state, around the country, and no one has a partnership quite like this in terms of just the collaboration to try to navigate such a pandemic. You know, often when clarity is definitely elusive. I am the superintendent of Lawrence Public Schools. This is starting my fourth year. These past year, I guess year and a half, has seemed like about 15 years, dog years, I guess. But it's been a challenge, but also exciting. And so we're just really ready to engage our students, continue to engage our students and families as they return in the fall. So thank you for having me on.
I guess I'm last, so I'll go ahead. Hi, everyone. My name is Mariel Ferreira. I am a Lawrence community organizer with Lawrence Mutual Aid Network and Sanctuary Alliance. My work specifically with the health department, with Ruaa and Alex, has been through Mutual Aid, a group that was started during the beginnings of the pandemic in an effort to get community together and start resource sharing and understanding that a lot of us were already in a place of disparity, in a place of need, and this pandemic just kind of heightened those things. So we were creating new ways of trying to be equitable, trying to do exactly what our name is, be mutual in how we help each other, and have had an incredible partnership with the health department in distributing tests and vaccinating and focusing on those who are most impacted, most marginalized, and have gone through this pandemic. I would say that's been kind of the silver lining, the kind of bright light for me throughout this whole pandemic. It's hard for me to say that because of all of the not so great things that have been unfortunately happening, but this partnership and just seeing the incredible work and the intentional work that the equity team and those who are in positions to do equity work have been doing, and the reach that they have is incredible. And so I'm just very honored to be here and to also be a community member and being able to have a platform to share my experiences. So thank you so much.
Thank you all for introducing yourselves and sharing a little bit about your roles locally. I think a lot of people see the work that we're doing and maybe even see your names and maybe have seen your face on a picture, but may not have had a chance to really see you speak or to, especially to hear you talk about some of these topics directly. So this is really a great opportunity for our audience. So thank you for making time tonight. I know we're all working full-time, overtime, and then also tonight. So I definitely appreciate all of your time tonight. I'm going to hand it off to Ruaa to get the panel started. Like I said, we're going to jump right into it.
Wonderful. So we'll go ahead and just start with our first question. And this will be for Dan and Mariel, but of course, everyone's welcome to jump in. The first question is, which demographics in Douglas County are under vaccinated? And what's being done to encourage vaccination, increase access, and build trust with these groups? So I'll open it up to Dan first.
Thank you, Ruaa. You know, when I look at our demographics, first I would start with, I'll put a link. I think I can put a link in the chat room. You know, we have a portion of our website where you can look at these statistics. They get updated regularly. And so I'm pulling from our website to answer this question. I go straight to the age distribution. And when I look at 18 to 24-year-olds, I see that 1 out of 3 18 to 24-year-olds are vaccinated, compared with 100% of everyone over 65, 3 out of 4 people 35 to 65, and 2 out of 3 for younger children. And so really it's that 18 to 24-year-old group that needs to, we need to focus on and make progress with. Our strategy to date has been to try to make it be accessible, reduce barriers to saying yes. And we'll continue to do that. I think some of this, Ruaa shared a story on Unified Command last week, where really the message was this takes building trust, and it's often victories measured in 1s, 2s, and 3s. And so we just need to continue to be persistent in that work.
Thank you, Dan, for your answer. Mariel, which demographics in Douglas County are under vaccinated, and what's being done to encourage increasing vaccination and testing in our community and with these groups?
Thank you, Ruaa. And just listening to Dan and listening to the statistics, I think is very important because there has been major success in getting folks vaccinated. I've been very fortunate to participate in vaccine clinics, and we would see, of course, the disparity or the reach not being able to access those who are marginalized identities, people of color, LGBTQ+, individuals who are historically pushed aside in the medical community. But in my experience, I have seen Douglas County do some very intentional efforts. We've had a BIPOC vaccine clinic, we've had Spanish speaking clinics. And so I think seeing that the age groups are where we're seeing the lower vaccination rates would just be a call to us to start intentionally reaching out to that group of individuals, that age group. And so we are a college town, and so I can see why the demographic is we have, those 18 plus individuals maybe not being vaccinated. And so I think the outreach is now, we've been intentional with the marginalized identities we've been reaching out to. I think we can also encompass those age groups. And there was a very, of course, concentrated effort for those that are 60 and over because they are high risk, but educating the younger generations and letting them know, hey, you're just at risk too, or at risk at transmitting this, and that could be potentially even more fatal. And as a community member, this is something you can do to be a part of the community, to help the health of the community and those who, do not have the ability to get vaccinated or have had a vaccine and it has not worked out for them. This is your opportunity to make sure that you're supporting them. And so I have no doubt in my mind that just seeing that data and knowing that we can definitely work together and see if we can start reaching out to that group a little bit more intentionally, just as we have with other demographics. So yeah, I think from what I've seen, this has been a very impressive journey in getting our communities vaccinated.
Thank you, Mariel. And it's been an amazing partnership with Lawrence Mutual Aid Network to really help us intentionally reach our Douglas County population. So big shout outs to you for that as well and the team. The next question I have is for Dr. Schrimsher. We may have some folks who've had COVID-19 that don't really see why they should get vaccinated. So what would you say about, why is it important for folks to get vaccinated even if they've had COVID-19?
There's multiple reasons to get vaccinated, even if you've been infected. I will say before I go on that if you are actively infected and supposed to be in isolation, then you should probably not go out and try to get the vaccine. It's not because it's not safe for you, but it's just that we try to limit the exposure to those that would be giving you the vaccine. There's several reasons. One is that we think that the duration of protection from vaccines is longer than that from natural infection. So I know it's changed multiple times, but we can say that if you have a natural infection, immunity from a natural infection, that probably somewhere between 3 and 6 months, your immunity starts to wane. Whereas with vaccines, we know it's well past 6 months. We think it's probably well past a year, but we don't know. Part of this is because there's, I think, I like the word robust. There's a more robust activation of the immune system, and it's not just the antibodies, but it's deeper than that. These cells that are kind of lying in wait in your immune system retain the memory of that virus and can activate your immune system even after long periods of time. Another big reason right now is variants. So natural infection does not protect as well against variants that the vaccine does. So kind of a similar reason, I think, because there's, instead of just a kind of a surface layer immune response, you have this deeper multi-layer, multiple cell lines involved immune response that seems to be better at recognizing and activating against a broader array of antigens. I'm trying to not use too many medical words, but your body recognizes a broader variety of the virus than just than would natural immunity. There was a study not too long ago in Kentucky that showed that people who were unvaccinated compared to vaccinated, those that were unvaccinated were well over 2 times as likely to get reinfected than those that were vaccinated.
Thank you, Dr. Schrimsher. And that's a great segue to the next question, which is, among those who are vaccinated, who is most at risk for a breakthrough infection? And can you talk a little bit about what a breakthrough infection is?
Yeah, a breakthrough infection is when you've been fully vaccinated, meaning it is 2 weeks or longer after you've completed the vaccine series. For those who received mRNA vaccines, that's 2 weeks after your second dose. For those who received the Johnson & Johnson vaccine, that's 2 weeks after your only dose. The most at-risk people for breakthrough infections, so even though they were vaccinated, they still got infected, are those whose immune systems don't work as well. I think the highest risk group is those that are on immunosuppression for solid organ transplants. But those who have hematologic malignancies, other cancers, other immunosuppressive medications, the commercials you see on TV all the time about whatever drug name that you can't pronounce, but it cures your psoriasis. Those people, and some studies showed a decreased response in some hemodialysis patients, so those who have to have dialysis. Bottom line is, the current recommendation for 1 dose or 2 doses of these vaccines does not seem to be eliciting enough of an immune response to help protect them from the virus. Did I answer the whole question?
You did. Thank you so much, Dr. Scrimsher. And for me, I just had this other question that I thought could be important. As a community near but not at 70% vaccination, what can we expect moving forward in terms of potential for outbreaks? Are we safe? And this can be directed to Dan and Dr. Schrimsher. And then we'll follow up with a question related to schools. So where are we at? And are we safe? And are there potentials for outbreaks?
Well, I'm going to jump in before Dr. Scrimsher because she's the expert here. But, I would say I'd use the term risk rather than safe because with higher vaccination rates, the risk of transmission lowers. Back on the question around why is it important for folks to get vaccinated? A public health answer would be, viruses need humans to live, at least those that like coronavirus. And so when we get vaccinated, we provide a dead end for that virus, and then it doesn't go to that next person. And so the more dead ends we have in our community, the less risk that we have. That's that word around herd immunity, which is much more complex than what the media portrays it to be. But nevertheless, I would say, yes, we can expect to see outbreaks moving forward, particularly in demographics that have lower vaccination rates. So, going back to the younger individuals, we expect to see outbreaks continue, at least in the near term.
Yeah, if you think of there's just looking at two factors: the percent that we have vaccinated and how easily the virus is transmitted. You're trying to reach this balance of herd immunity, but the quicker and easier a virus can spread, the higher number of people, the higher percentage of people you have to have vaccinated to achieve, quote, herd immunity.
Thank you, Dan and Dr. Schrimsher. This is a question for Dr. Lewis. It's a follow-up to the previous one. To the best of your knowledge, will any of the restrictions imposed earlier in the pandemic possibly return?
Well, one of the things we know, hopefully everyone in the community knows that we are requiring masks for all of our students pre-K-12. So that's one restriction that will return in the fall. And at one point, Lawrence Public Schools in Kansas City, Kansas, were about the only two schools in the state that required some form of mask. But as you're seeing in the news, there are more and more districts that are requiring masks at some level, whether it's elementary or K-12. Other restrictions, we will limit the number of visitors in our buildings. Also, we will limit indoor field trips. So in other words, students can take field trips. Again, masks will be required on all modes of transportation in the school district, and we will limit those field trips to only outdoor locations. Obviously, all of this is subject to change. We will continue to work with our federal, state, and local health officials and collaborate closely with them. As you know, things change daily. So as of right now, those are the only restrictions. When the governor closed schools back in March of 2020, the State Board of Education had to take some action in order for us to operate in a remote setting. That since has changed, and we can no longer operate in a remote setting. And so that restriction will not be there. Well, let me take that back. We can operate in a remote setting, but it's limited to 40 hours per year per student. And so unless the governor or the State Board of Education takes action, I think it's House Bill 2124 that requires us to limit the number of remote hours to only 40. So those are the only restrictions that we have. I won't say the only, but those are some of the main restrictions that we have for this coming fall. All of our restrictions and our mitigation strategies are located on our website, usd497.org/COVID-19.
Thank you, Dr. Lewis, for your answer and for all your work to keep our students safe. Dan, I wanted to open it up to you as well. To the best of your knowledge, will any of the restrictions imposed earlier in the pandemic possibly return?
The short answer is yes. We recently released a new community guidance tool that talks about whether we're in green, yellow, and red. It's kind of the next generation of the school gating criteria from last school year. And so we tried to simplify it. And currently today we're in yellow. That means we have more than 25 cases, new cases a day, and over 500 active cases total. And that guidance calls for public health to consider imposing restrictions when we get to red, which is more than 50 new cases a day and more than 1,000 active cases. And to put that in perspective, that would take us back to how we looked back in late January, early February. If you haven't blocked that from your mind, that would be kind of the comparison.
Thank you so much, both of you, for your answers. That was a very common question that we were receiving, was related to what can people expect going into the fall in terms of gathering limits, masking, all of that. So yeah, thank you a lot for answering that. Next question was another very popular question, and feel free to answer the parts of it that stick out to you, Dan. It's, do we think the vaccine will become mandated by some employers, schools, or public spaces like the library?
Well, currently I'm trying to encourage organizations. I wouldn't call it mandate, but I would call it incentivize. So we're trying to encourage organizations to incentivize their employees to become vaccinated. And so the hope there is that we can send the message to our community that we support vaccinations and we support masks, and rather than the narrative that of, okay, I'll comply if you make me, but rather we support these things as good practices. So we're about trying to encourage organizations and employers to work through what it looks like for their employees to be vaccinated, and then send the message to our community that join us.
Thank you. And another question for you. What does enforcement of public health guidelines and potential mandates or encouragements look like for the rest of 2021?
Well, enforcement to me means we've gone to the step of issuing a public health order. And it kind of depends what that is. So, I'll just assume that it's a mask mandate order. And how we managed that in the past was, there's really not an enforcement that's effective or for an individual. So our focus in the past, and likely what we do in the future, would be work with businesses. So we might get a complaint about business A or B, not requiring masks. And so we'd reach out and work with them to try to gain their compliance.
Thank you so much. I know that these can be difficult questions because we don't know what the future holds exactly, and we need to be adaptable. So thank you for providing, as much to your best knowledge that you can right now. This next question is for Dan, Mariel, and Dr. Lewis. If these things speak to you based on your different prowesses, how will local leadership support community members who are at higher risk of infection and or adverse effects of quarantining guidelines? So this can be people who can't take a day off or don't have childcare or live in congregate living settings. I'll hand it to Dan first.
Did you say my name?
I did, but if you need a break, I'll go to Mariel first.
Okay, thank you. Well, here's my answer. Just give her time to get geared up. I go to what's the prevention component to how do we support our community members, and prevention is get vaccinated now, and we've issued the call to any business. Several weeks ago, we have a form on our website. If you want us to come out, submit the form and we'll come out and vaccinate your employees. And so that's, to me, the best way to support workers, especially those that, are in that public facing service industry. Please get vaccinated.
Awesome. I'll hand it off to Mariel if you want to speak to the way that question may relate to your work in the community.
Sure. I think that's a where we're at right now, a very complicated question because distribution of resources has been what I would consider not the best. Through mutual aid and just through the last year and a half, that has been our question. How do we support folks, and how do we support these community members who have families who can't afford to lose a day of work? And I would have to agree with Dan that the first thing is prevention. This vaccine is a preventative. It can help mitigate this possibility of you getting sick, of you having to encounter all of the hardships that would happen if you were to get COVID. What I think I have seen as the community step up in spaces where our state and federal government have not been able to step up and providing funding and resource sharing to help support those who may need childcare, to help support those who are losing their jobs or unable to go to work and are subsequently not able to have food or rent or things like that. And so it's tough, but I do think the community is doing an incredible job of coming together. And what I would love to see is more resources. The more we resource individuals, the more we resource community members, the more funding we can give people, because that's the reality of it, is we still have all of these bills and things that we need to pay and people we need to take care of. It would be incredible to see more funding coming in so these social service agencies, these grassroots organizations can feel empowered to do more. We're definitely spinning our wheels sometimes, but I think I have witnessed a couple moments where community has come together. And I think the more we empower those communities, the more we put resource into those communities, the more we're going to see the protection in addition to the call to get vaccinated. So mutual aid will continue to share resources as much as we possibly can. Right now, we're pushing the CARE program. If you need to pay your rent, please apply for it. If you need any help, that's what we're here for, is to advocate and try to find those resources. And I think that's, for now, the best we can do is just be that place people can come to if they need something, and we can help them navigate it.
Thanks so much for your answer, Mariel. Handing it off to Dr. Lewis.
Hi, yes, we are. And I would echo everyone else's comments around, first of all, vaccinations and also to continue to point out that as a school system, we follow Lawrence Douglas County guidelines as it relates to quarantine. As a matter of fact, we collaborate and work with them, and they help us identify those individuals that need to isolate or quarantine. Now, should our staff member have to take some days off for themselves, i.e. meaning that they have been exposed and have to quarantine, or they are parents. Many of our educators are and staff members are parents, and they may have to quarantine with a child. And so we are currently having conversations internally about what is the best way, the most cost efficient way that we can support our staff to make sure that they're not having to use all of their sick days. In an event that they are using all of their sick days and they do get around to a point where they have no more sick days, there is some funding available through our ESSER funding that we can possibly put into our application. Obviously, all this has to be approved at the state level, that will allow those individuals that are out of sick days to be paid out of our ESSER funding. But again, that's something that has to be approved by the State Department.
Thanks so much, everybody. And we are entering maybe the last 5 or so minutes of this pre-selected question. So lean speech. Let's get through this. Last question that I have before I hand it off to Ruaa for some more questions about schools. We got a lot of questions about that. was, we are entering the school year, and we're expecting a lot of incoming students for KU, Haskell, as well as students for the K through 12 public schools to be going in person. How will the start of the school year potentially affect local case rates for COVID-19? And I'm going to hand it off to Dr. Scrimsher.
They will increase. I mean, we're asking a large number of individuals who happen to be in that 18 to 24 age range or 34 age range that have not been vaccinated. I mean, the rates are lower in that age group. So a large number of individuals, a lot of them haven't been vaccinated. They're coming from all over. I can't imagine that we will not have an increase in cases. And then add the extracurriculars, like what college students typically do as far as going out and socializing, and then being, having to be intentional about classroom setups and on-campus activities to reduce the risk as much as we can there. But yeah, they'll increase.
Thank you so much. A follow-up question, and I'm going to point this to Dan, is, as far as we know right now, what will KU be requiring of students, such as testing?
It's the short answer would be it's kind of sporadic. They don't have, to my understanding, a kind of universal policy or something that's going to, reach, thousands of students. They're focusing more on different kinds of housing situations and showing proof of vaccination. So kind of a hodgepodge of policies at the university.
Thank you for that.
I think they're requiring it for all. I think they're requiring it for all on campus, and then offering it to all off campus students testing, and then we'll have vaccination opportunities, numerous opportunities for the kids to get vaccinated.
Awesome. I'm going to hand it off to Ruaa. I know we have some last questions also for Dr. Lewis here, more about schools.
Thank you, Alex. We'll ask these last few questions before opening it up to our public questions. So I wanted to ask Dr. Lewis, how is Lawrence Public Schools planning to mitigate risks in school? I know you touched on that, but wanted to give you space to kind of talk more about it.
Yes, absolutely. And I cannot stress how important in-person learning is. And so there are some things, and I'll share with you some things that we're doing in our schools to mitigate risk. But I would just encourage everyone in the public, when our kids are not with us, let's be responsible adults and mask up. Definitely we're around those younger ones that don't have the opportunity to be vaccinated. It's so much that we can do as a school. We have to come together as a community to make sure that we are keeping our kids in school, because we know that they benefit from in-person learning. And so we've outlined some strategies that will assist us in maintaining those safe learning environments for our students and our staff. And so again, as I stated before, we will definitely continue to work in collaboration with our local health officials to make sure that we are monitoring the community spread. So again, note that these mitigation strategies are subject to change. One of the things that I don't know if a lot of people know, we have our board, thanks to our board, our board approved the purchase of air purifiers. So in each classroom, in each office space, in each large space where our students will be, we'll have air purifiers. And these are medical grade air purifiers that are in a lot of hospitals and can function. I tell you, through this pandemic, I probably learned so much about air quality than the average HVAC person probably. But these air purifiers can go anywhere from maybe a fourth to maybe 2 air exchanges per hour, and that's pretty good. And so all of those will be functioning in our classrooms. And in addition, we will have all of our students, pre-K 12 and staff will be required to wear masks, whether you're vaccinated or not. We will try to observe 3 feet social distance as much as possible. We are looking into the possibility of hiring additional teachers with those large class sizes. That's something that, again, we will have to put in our ESSER application to be approved by the state. We have talked to our medical officials. If you recall, last year we would line kids up and they would take the temperatures as they come through the building. Those devices will still be available. We will not require all of our students to take their temperatures. If there's, first of all, the first line of defense is our parents. If your students are feeling sick, or if you have a thermometer at home, just do some quick screening at home before you send your kids to school. And so those are just some of the strategies that will take place. We are looking, particularly in our elementary schools, of no longer requiring large areas, cafeteria areas where students will eat without their masks. They will be in the classroom. We will observe the large spaces for some of our younger students, but obviously they will be spaced out in the cafeteria. And in addition to that, we are hosting some vaccination clinics at our secondary schools at Free State, Billy Mills, Liberty Memorial, and LHS, and those are happening as of today, all the way through August 25th.
Thank you, Dr. Lewis, for your answer. One question I did have is, what would you say for a parent who is not comfortable with in-person instruction? Do you have any words of comfort, or what can they do if for some folks in-person instruction just makes them nervous?
Yeah, I would say first have a conversation with your child's teacher, your child's principal, to just get an idea of what an average day will look like for your child. You may be in a smaller class setting. You may be in an area that you may feel comfortable. Should you not feel comfortable, I will say that we do offer the Lawrence Virtual School. We've been operating in a virtual world here in Lawrence for over 15 years. And so Lawrence Virtual School is still an option for our families that may not feel comfortable sending their children back to school. So that still is an option for parents to enroll. But obviously we want to make sure you communicate with your child's teacher, just to kind of get a walkthrough and just a thorough understanding of what you might expect of your child, of the school and the classroom environment.
Thank you so much. I have my second to last pre-selected question. This one's for Mariel. And I know that after 7, we'll go into the coronavirus hub, which has resources as well as where people can get tested. But I wanted to give you space, Mariel, to answer, can I get tested for COVID-19 even if I don't have symptoms? As of right now, when are tests available or where?
That's such a good question. Yes, please, especially if you have potentially been exposed, if somebody has reached out to you and said, hey, I have COVID and I was with you, please get tested. Lawrence Mutual Aid Network has partnered with the health department since the beginning of this year to provide the PCR tests, so the saliva tests. These tests are at home, so you can pick up a test from us. You just need to reach out to us on our Facebook page or message lfkmutualaid@gmail.com, and I can put that in the chat. And we can deliver these tests to you. You can either take the test right then and there, you put it in a biohazard bag, and we will deliver it. Or if you want to do it yourself, we have a FedEx bag that you can drop off. Make sure that you drop it off at the FedEx, not place it in a bin, because we want to make sure that it gets to the labs, or you can drop them off at the hospital. You'll get your test results in the 24 to 72 hours. There are also a multitude of testing clinics that you can go to that the health department and other companies and organizations have available. So please, even if you do not have symptoms, but you know you've been exposed, especially with Delta, it's such a good idea to test just to make sure to keep everyone around you safe and to keep yourself safe.
Thank you, Mariel, for your answer. This last pre-selected question is for Dr. Schrimsher. We have folks sometimes asking about whether they have symptoms and what they can do. So what are the current recommendations to someone or their family if they're exposed to COVID-19?
It kind of depends on if you have been vaccinated or not. And I hope I don't screw this up because it keeps changing. If you have been vaccinated, you do not have to quarantine. The recommendation is to get tested at 3 to 5 days, and again at 7 to 10 days. The wording around what to do as far as masking and whatnot is a little complicated, because we are recommending, and they did change their recommendation for people to wear masks in indoor public spaces. at baseline. So my recommendation for vaccinated and exposed is to not quarantine, but to continue to monitor your symptoms daily and wear a mask in indoor public spaces. And I like to add outdoor crowded spaces where you're not able to distance, but to continue to monitor for 14 days. For unvaccinated people, we're asking them to quarantine for 10 days. I have requested to add on, without changing the order for quarantine, to just add on to that quarantine for 10 days, but to continue to monitor your symptoms and wear a mask around others for the full 14 days. Dan, correct me if I was wrong on any of that.
Oh, you need to unmute yourself.
Yeah. Well, after all that, thumbs up for me, Dr. Scrimsher.
I sometimes have to see it in writing because it gets confusing.
Thank you, Dr. Schrimsher, and everybody. We'll now open it up. I'll pass it on to Alex for our public questions.
Yeah, this is always my favorite part. I get to see what questions people wanted to wait till they got here to ask. And so we have a list of some really great questions. As I put into the chat, if you had multiple questions, we are going to make sure that we get at least a question from each person before we go back and answer some of those multiple questions thing. And I will do my best to kind of guess, or panelists can also volunteer themselves as to who should answer which question. The first question kind of sounds like maybe a Dr. Scrimsher question. Somebody is asking if we could explain the current treatment plan for COVID and how it has evolved over the last year and a half. And they're also saying that they're assuming that people are probably being treated different now than they were at the beginning of coronavirus.
At the very beginning, yeah, because we didn't really have anything. We didn't know anything. But from the fall, it's very similar. For outpatients, for typically higher risk outpatients, so with certain medical conditions or who have a higher BMI, we have monoclonals available. And we have a great program that tries to get these people identified or get consults from physicians, get them into our clinic, which is what, from my desk, I look into the area that we do these infusions and get a monoclonal infusion. I think the number that we've had subsequently end up in the hospital is really low. I don't want to give a certain number, but like maybe 1 or 3 or something. So they're very effective. It's the one we have right now is Regeneron. I think we're looking at getting a couple others if we can. So those are for outpatients. If you are sick enough to go to the hospital and get admitted to the hospital and be on oxygen or more oxygen than you're on normally, then we treat people with remdesivir and steroids, typically, dexamethasone. And then in certain cases, when people don't respond or they decompensate quickly and require being in the ICU, there's another drug we have, tocilizumab, we call it TOSI for short, to try and decrease that inflammatory response that kind of acts as a snowball effect and people get sicker quickly. There's a couple of other drugs similar to that one that are available, but that's the only one we have in-house. So I think that was more information that people wanted to know.
Information is power. So yeah, thanks for sharing that. Next question, it may be for Dr. Scrimsher or maybe Dan. They're wondering what the word is on vaccination for children under the age of 12. And in the meantime, what can they be doing to keep their children safe, especially as they go into public spaces with them and they can't wear a mask, young children?
All we have is maybe a slightly more informed rumor mill. We've heard fall, but I'm hopeful that Dr. Scrimsher can provide a more studied answer.
I heard, the last I heard was for Pfizer for the 6 to 11 was, or 5 to 11 was maybe September. but they are very, it also says this calendar year. And then for adolescents, for Moderna, that's coming pretty quickly. I think that's one of the next discussions at the upcoming ACIP meeting. And then I've also heard for 2 to 5 and 6 months to 2 years, potentially later this year for Pfizer.
Thank you so much. Next question that I've got from the chat is for Dr. Lewis. Would you be able to say a few things about how we'll handle their quarantine and the 40-hour limit? If the person, maybe it was Kay that asked this question, if you feel like elaborating in any kind of way, but I think what I'm gathering is you want to learn about, is that a flexible limit?
Yeah, this is Kay Emerson. And so the question kind of from the community that I've been receiving is just, with our 40-hour limit now with the legislation that came down through this last session, if a student's going to have to potentially quarantine, let's say, for 10 days, that's essentially, that 40 hours of remote learning. And so families are kind of wondering, what is the plan, or what can they expect, or what may happen. And so I was just hoping if you could speak to that and be able to provide some words to our families in the community that are having that question.
Yeah, certainly. Again, we will work with the Lawrence Douglas County Health Department, and they will help us identify those individuals that need to quarantine. Also keeping in mind those new guidelines that were just released from KDHE around potentially unvaccinated people or vaccinated people may not have to quarantine. And so we'll follow those guidelines. We've also been having conversations around, because you're right, 40 hours is not a lot. That's, one quarantine period can eat that time up. And I guess the negative impact that will have on school districts, if we go over that 40 hours, then our funding goes down to about $5,000 per pupil. And to put that in perspective, we typically get over $14,000 per pupil. And so that will impact us financially. And so we'll work with parents, we'll work with our schools to see, is this an option where we need to use this remote day? Is this an option for this student to do maybe some independent work at home, and we count this as maybe an excused absence? And so we're having those conversations now, because again, that's House Bill 2134. I think I gave the incorrect number there earlier, that was approved not too long ago, or that limited that number to 40 hours. And so we definitely want to make sure that the goal is for students to make sure that they are receiving the best education possible. But obviously we don't want to have a negative impact from a financial standpoint. Again, anything that goes over 40 will require board action, local and state board action, but it will get down to that $5,000. And so I guess the short answer to that is we're still kind of talking about how will that impact us, from an academic standpoint, i.e., is it an excused absence, or do we need to tap into some of this remote learning? So more to come on that, Kay.
Thank you, Dr. Lewis.
Thank you, Kay. Always great questions. Thanks for coming tonight, by the way. Another kind of follow-up question that we also received in the chat, Dr. Lewis, that's a little bit related to that question is, what about when students go on vacation, potentially with their families? Are they going to be required to quarantine when they come back? And then again, that 40 hours question comes back into play.
Yes, and we haven't received any guidance around that in terms of, in the past, there were some hot spots. So there were some hot, and I call them hot spots, those locations that had really high number of COVID cases. And so we'll, again, lean on health officials to tell us, okay, if someone comes from whatever this state, have them quarantine. And so right now we haven't received that guidance to that we could, tell parents that, hey, since you came from this location, you would have to quarantine. I would, again, just say monitor your child's symptoms. Again, make sure that they're masking up on vacation. We're actually in Alabama now. I'm dropping 2 kids off to college. And I will tell you, when we stop and go in places with our mask on, people look at us like we're crazy. But our kids are still going to go in these places with masks on. And so if you are going on vacation, still be responsible. No, don't, it doesn't matter how many crazy looks you get, because you will have to come back to Lawrence.
Great points. Thank you for answering all these questions related to schools. We do have another one related to schools, and then I promise that there are some other kinds of questions for maybe there's audience members who don't have a lot of care about that. But another school related question is who's eligible for virtual schools? Is it only residents in certain cities or zip codes?
Anyone in the state of Kansas. So if you live in the state of Kansas, you are eligible for Lawrence Virtual School.
Awesome. Thank you. Another question here is, why was the decision made not to enact mask mandates until we reached the previous peak from January and February? Wouldn't earlier mask mandates help prevent us from reaching levels like that?
I'll try to answer that one. You know, this is really about how do we change behavior? And there's two lines of thought, at least two. One is that people, it's about compliance and enforcement and issuing orders. And the second is really about creating new norms, a social norm that says, Dr. Lewis spoke to it. Hey, when you get back to Lawrence, mask up, that's our norm. And so that's the tack that I'm focusing on right now. Is can we create a new normal in this community, this county, that says let's mask up, let's vaccinate, and try to not have to go to the compliance question.
Thank you, Dan. Thank you all for just giving these answers, just on the fly like this. We really appreciate your time and energy. Another question is, considering that vaccinated and unvaccinated people can spread the virus, what recommendations can you give to help everyone boost their immune systems or other types of solutions? And again, I think that might be Dr. Scrimsher, might be Dan.
Do the good thing. Eat the green things, drink the water, get outdoors, exercise, don't smoke, limit alcohol, don't do drugs. I mean, all the things that we tell you normally, all the things that are not as fun as not being healthy. But, and I think mental health has been a big part of this as well, to make sure that you recognize, address, ask for help, talk to somebody about that, because that can take you down pretty quick.
Dan, anything to add to that?
No, I think that's great advice. I'll try to follow it, Dr. Scrimsher.
She's our doctor tonight. Another question. So how will unvaccinated children be kept safe during lunchtime specifically? I think maybe they're asking this because presumably they can't wear their masks while they're eating.
Right, that's correct. And so we will follow similar strategies that we did in the spring with our elementary students. As I mentioned earlier, many of them, and keep in mind, these will be school-based decisions, because we have some elementary schools that have around maybe 215 kids, all the way up to elementary schools that have over 600 kids. And so they will have to come up with a lunch schedule that will keep our kids safe. And so students will be eating in the classroom, obviously spaced out when they're taking their obviously they have to take their mask off when they're eating, and so they'll be spaced out there. We will utilize cafeteria and other large spaces and spread kids out, so that they can eat, obviously, but most importantly, making sure that they are safe. And again, as I mentioned, those air purifiers will be going in all of those locations, and so we'll do all we can to make sure that our kids are safe during the times that they are having their mask off.
Thank you, Dr. Lewis. I actually have some of those high-tech air purifiers in my home because I have terrible allergies, and I've been doing great since I've had them. Anecdotal evidence. So just a heads up, air purifiers have increased in their efficacy. So let's see. I think we have time for one last question from the public. We do have a few that were some of people's kind of second, third, fourth questions. And don't worry, we will get back to you. I'm going to save the chat and I'll have your registration information. So the only way I wouldn't be able to get back to you is if you changed your name on Zoom and it's different from the way you registered. If that's the case, reach out to me here on the Zoom chat so that I know that. But last question is, and maybe this is Dr. Scrimsher as well, are all the COVID inpatients listed on the LMH website actually there because of COVID, Or are some of the patients there for other procedures and just happen to have COVID or tested positive while they were there? I think it's kind of a question of how the data is listed.
Yeah, and I think there's a couple ways to answer that. Are there patients who are on the list who were admitted for something else but incidentally tested positive? And the answer is yes. However, I think it's really hard to determine what all disease states you can say are unrelated. You know, while altered mental status isn't on the list of report these symptoms, you know, when you get to work, right? Cough, runny nose, altered mental status is not on there. But do I think that in an elderly person who is ill, that is one of the presenting symptoms? Absolutely. There's also other things like blood clots that we can say are likely related to COVID. And another way to look at that is these people still require resources in excess of what we would normally do for any other hospitalized patients. They have to be in either a special room or a special unit. The staff has to use special PPE. So as far as resource requirements, I think it's important to know.
Thank you, Dr. Scrimsher, and thank you again, all the panelists, for answering these questions on the fly, and of course for answering our pre-selected questions that came from the question submission form and people that had questions ahead of tonight. So, and thank you, audience members who submitted questions. We are going to move on to where we have an equity impact advisor presentation sharing about some of the equity efforts that we've been involved in, and a little bit more about vaccination data as well. So if you're interested in that, stay with us. We're also going to go over in detail some of the local resources that are available to you to find out and stay updated on information and to learn what's happening next here in our community. We're going to walk through them with you here on the screen, so it should be pretty great resources for you to take away. We're also going to put those resources in the event page. And I'm going to hand it off to Ruaa. Do you have any other thanks for our panelists before we do the presentation?
Thanks, Alex. I am good. I think we are ready for the presentation.
Awesome. Well, we'll be sure to talk more and to thank our panelists again before the event is over. But I'm going to invite, we have another equity impact advisor with us tonight, Elizabeth. Hello.
Good evening.
All right, so I'm queuing you up to get started.
Perfect, thank you. All right, well, thank you everyone, and thank you for joining us this evening. Big thanks to Alex and all of her hard work for putting this presentation together. It's truly a joy to work with all of the folks on the Equity Impact team. So just a quick overview. So Equity Impact Advisors serve through the Douglas County Unified Command with regard to COVID-19 response and recovery. This team and this presentation is going to go over the impacts that we made in the community, the lessons that we learned during this process, and our continued commitment to this work and how we're going to really work to push it forward. A few examples of some of the impact that have been made are some of the equity clinics that we've done with Heartland. So we reached 1,041 community members who otherwise had barriers to receiving healthcare access. We also went out into the community and did things like BIPOC clinics, which were done in conjunction with KDHE. These were really phenomenal clinics where people felt safe and included. It really helps folks to see people who look like them administering vaccines. We also had Spanish-speaking clinics throughout the community. We recognize that our Latino population in Lawrence continues to grow, and our Spanish speakers also continue to need services, just like the rest of us. So we had some Spanish-speaking clinics that were staffed by all Spanish speakers. So that was a pretty fantastic experience, and to watch people who didn't know where to go to receive vaccination or testing information be able to communicate freely and openly was a really powerful thing to see. There's also, we push for BIPOC concerns, BIPOC patient concerns. So, we know, and I'm sure that, Alex and Ruaa will speak a little bit more in depth on this, but this is something that we know that people of color, there's an aversion to engaging with healthcare systems. So one of the things that we really focused on was how do we provide a space for people to speak openly and freely, and validate everyone's need to equally achieve health. So I will pass it over to Ruaa, who can give you a little bit more in-depth conversation on on testing. Thanks so much.
Thank you, Elizabeth, for sharing about the work of the Equity Impact Advisors. I'm really glad to share a little bit, and we can go to that slide with the photos to just really share the story of, community reach and really intentionality behind connecting with people. So the photos that you see here, so the one to the left, we have Dr. Vicki Clay-Akers, Alex, and I, and this was at Starbucks. And we held 2 events at the Starbucks on 23rd Street because it was just a location that was perfect in reaching a variety of different individuals in our community. And it was meeting people where they're at. So Starbucks was a wonderful partner in providing people with coffee on these really hot days. And we were able to have both vaccines and testing available for our community. This was just an opportunity to connect people. We were out there doing testing, and we had gift cards and other incentives because we're wanting to thank people for being able to be out there and to get tested and vaccinated and in caring for their community. So we have gift cards at these events. On the right is the Lawrence Public Library. We have Dr. Farah Ahmed, who's the state epidemiologist, along with Dina Lynn, a nurse, Alex and I. And this was a great spot at the library because we are able to get people as they're just at the library. They may not know that they want to test that day or a vaccine, but just being able to be right there where folks are at, having gift cards as well, having a festive environment. So contracting with, a magician, who happened to be a Black woman that did an amazing job. And the kids were, just engaged to kind of create an environment that feels a bit more festive, I think has been really successful. And from that first event to the second, we almost doubled folks getting tested. Part of that was because individuals were concerned about the Delta variant. So we are continuing to see how to support vaccinations in our community and testing by being out there. The different websites we're going to share with you, one, which is the calendar of events. That's where you'll find at these vaccine clinics an opportunity to test as well. And we'll be trying to bring out these different gift cards and prizes to the events to just continue to incentivize and support our community. So these photos just describe a little bit of some of the work that we're doing to intentionally reach people. And I wanted to really thank the Equity Impact Advisors. Dr. Hassaballa-Muhammad really helped me connect with local businesses that are BIPOC owned that we can support in our efforts as we reach individuals and purchase raffle prizes. So this included Body Truth, where we were able to purchase gift cards. We were able to support local artists. So I'm really glad for our EIAs and Christina Gentry with the testing, really ramping up efforts because we've tripled our testing in the last few weeks. So just wanted to give a big shout out to the Equity Impact team.
Thank you, Ruaa. And these were such fun clinics to get to work on together, and getting to give people gift cards and do raffle prizes and drawings was really great, and definitely was very incentivizing for people as well. So thanks for your teamwork on that. So like I said, I'm part of the vaccination unit at the health department and part of Unified Command. And we do have a couple of updated vaccination data to share with you. One of the trends that we see nationally and is also represented locally is that people of color, Black, Indigenous people of color, are more likely to receive their vaccines more recently than they were earlier on in the vaccine rollout. And so we're definitely seeing that locally as well as nationally. Nationally, only about 1 in 4 Black or African American residents have received at least one of their vaccine doses, if it's the 2-dose vaccine, Pfizer or Moderna. Locally, however, we have 41.3% of our Black and African American community members are vaccinated. And so that, that's partially as a result of our equity clinics that we designed earlier on that looked at barriers that were adjacent to being BIPOC or having language barriers or other things that may pertain to ethnic identities. It was also partially in part of a lot of intentional work on Unified Command's part by having an equity impact advisory team that was every step of the way advising on things that would make clinics more welcoming, more accessible, getting help for people that did not have transportation to even go to appointments and things like that. It's a really great work locally for Black and African American residents. Nationally, about 47% of Hispanic residents are vaccinated. Locally, we're pretty close to that. We're less than 1% off. In fact, we're at 46.3% of Hispanic identifying individuals are vaccinated. And that is compared to 53% of people in our community who are non-Hispanic identifying. So in terms of, from an equity perspective and from, looking at those things being less than 10% from each other, that's still significant, but it's not as significant as we may see in some other communities. And so just something to be aware of, that we're pretty on par for the national average with Hispanic identifying individuals. And a lot of that, a lot of the work that we have done has been through free translation and partially paid translation from community members that have helped us to take our materials and put them into Spanish so that people reading them can see when and where the testing and vaccine sites are. We also advocated for sanctuary policies at our clinics, reduced law enforcement or no law enforcement presence, not requiring IDs or excessive personal information just to get the vaccine, things like that. I'm not going to go too into detail about some of our lessons learned. We definitely learned that medical mistrust, like in a lot of communities, definitely exists in our community. And we have an unusual situation in that, at least in Lawrence, we just have the one hospital. And so, as a person of color myself, I'm Black and Native. I was, talking with a lot of families and patients, and in terms of their hesitance to get tested or vaccinated. And a lot of it had to do with, if anybody in the family ever had a bad experience with the health department or LMH Health or, these limited clinics that we have here, there was ongoing hesitance for family members of that group to go in for testing and vaccination. And so that was definitely a barrier that we were coming up against, and one that is not easily solved. You can't just flip, generational trauma and medical mistrust with just a couple of flyers. And so that's something that we definitely are working incrementally towards, and definitely trying to increase representation of, the types of nurses and people that we have working with patients at the library clinic. For example, there was a Black man. He might have been around my father's age, maybe in his 40s. And he only wanted to be vaccinated by the woman of color nurse that was present. And I'm just thinking about, what if she wasn't there? Would he have not chosen to get vaccinated that day? And so that's just an example of the kinds of things that we were thinking about in terms of being intentional to reaching our BIPOC community members. We also learned that scheduling was a big problem. A lot of people are just literally working multiple jobs, or they work their job and then they have children. And in order for them to even come get tested or come get, what if they got a positive result? What are the economic implications of that? And then also to get vaccinated, people were not sure if they would even have 12 hours to be sick, potentially with side effects, if they were somebody who would present with those. And so it was definitely tough trying to find ways and resources to help people make decisions that did not have to be limited by things like that. And then I'm going to go ahead and move on to the next slide. This is just a picture of our Equity Impact Advisory team, in case you wanted to know some of the names and faces associated with that. As you see here tonight, you see Ruaa in the top right there. We also have Elizabeth Stevens and myself. Others are, on this team represent the schools, the city, the county, etc. So that's what that's how we were comprised. Awesome. Is there anything else that, Ruaa or Elizabeth, that I may have missed? Okay, well, let's get right into, thank you. Thank you, Elizabeth, also for taking time tonight to come here. All right, I'm going to hand it off to Ruaa to start sharing about resources.
Thank you, Alex. So in these 10 minutes, we'll dedicate to sharing about resources and then closing. So really appreciate y'all's time today. And what I'll do is start by sharing the screen for our Coronavirus Hub website. I'll go ahead and paste it onto our chat. This is where I'll share screen. I won't go into detail over everything, but this is really the hub where information that's really important surrounding the pandemic COVID-19 is found. So I'll go ahead and share screen. And the main part of that website itself was a graphic that's been updated about where you can find testing. So let me go ahead and share screen. And so this is the Coronavirus Hub. And when you go here, you'll first see, a description of COVID-19 and then some numbers to give you an idea of where we're at as a county compared to Kansas overall. So you can see here that our test positivity rate is currently about 3.4%, with completed vaccine series at 57.4%, which really is, a high percentage compared to Kansas overall. But as you go here, you'll see any updates. So today's panel is right there. But I just wanted to share with you that there's different resources around where you can get a vaccine. So Lawrence Douglas County Public Health is available for walk-ins, and that is Monday through Friday. And so you'll see the times here that are available. You can walk in, so no appointment is necessary. And even if someone doesn't have ID or insurance, they're still encouraged to get vaccinated, and they're welcome to come. We have LMH Health primary care clinics, as well as several different pharmacies in our area that are offering vaccinations. So this website's really helpful to be able to find these different resources. This is just some information about vaccinations administered in Douglas County. My role with testing is key. So, this, has some guidelines and some other information that we can dive into deeper later. But I really wanted to highlight this right here, which is where you can get tested for COVID-19. We've definitely seen an increase in testing. The one place that I wanted to first share about was the Walmart on Iowa Street. That's open Monday through Saturday, 7 a.m. to 4:30 p.m. And I actually stopped by there today, and the individual that's there every day conducting these different tests, and they're the saliva CRL tests where you get your results in about 48 hours. She shared that they did 260 tests just yesterday. So I know with schools reopening, Eudora, for example, has shared with their community to come and get tested at this Walmart site. This is one area that you can get tested, but these different pharmacies are definitely available. Orchards Drug, I believe, has rapid testing as well. We're going to get a shipment of rapid testing, here in the upcoming week or two. So we'll be sure to share out with our community where folks can get some of those. But we have testing available at the health department as well, the same times as you would see for vaccinations. So I just wanted to share that with individuals and also let you know that if you'd like to take a test home, we can make that available. We have test kits in our health department. Feel free to reach out to me or Christina Gentry. We can put our information here. Brian Bradfield with LMH is also partnering with us, or our Lawrence Mutual Aid Network partners. You can come to the health department and pick up take-home test kits. And so we are currently trying to see if we can get some more. We are going to plan to have a testing handout event on August 21st. That's a Saturday. We'll definitely be sure to promote that out, have flyers in our community. And that's from Saturday, 10 a.m. to 2 p.m. And that will be a testing handout event in partnership with Lawrence Memorial Hospital, where if folks want to take those saliva PCR tests for pickup to use for when they need it, they can do so. And businesses as well that are interested can reach out to us. So I just wanted to let you know that there are different ways to get tested in our community and to reach out if you need anything. Anything that you might add, Alex, there?
No, I think that I'm going to go ahead and put my email in the chat. So now you participants, you know somebody, you can reach out to someone specifically instead of calling the clinic number. But yeah, if you have questions about, where to find the links, to find, about upcoming clinics or questions about things, there's a chance that we may be able to answer it for you. So I'm putting my email in there Ruaa, Christina, if you feel comfortable, you may also. But I think the last resource that we have to share about is that calendar of upcoming clinic events. I did already put that into the chat. This is, you can look at it in this kind of calendar view. You can look at it as just a list like this. I kind of like the list view. There's a variety of calendars. And so we do have one that's specific to vaccine clinics. Right now, I just have all of them selected because there's lots of different events going on. But you can go here to view more details, see the date, time, where it's at. If I wanted to learn more about house school students, you can learn some more information here. So this is a really good resource. So, if you're just wondering where you can get your second dose or even your first dose, a lot of the clinics that that me and Ruaa have planned have both testing and vaccines, but be sure to check the details so that you know what's being offered at that clinic. Anything that's listed here though for COVID vaccine clinic should for sure have vaccines.
Thank you, Alex. In these last few minutes that we have before the end of this panel discussion, I just wanted to thank everybody for taking time today and just to share that, with this pandemic and just the changing updates, to be able to connect with the community and share resources, information, what I really appreciate that and wanted to open it up in case our panelists had any final words to share.
Wear a mask, get vaccinated. Those are my words. I mean, that's my wish list, please.
I'll second that and add that, this is, a marathon, and we need to kind of take care of ourselves along each day, along this journey, and please support one another as we go through this journey called life.
I could third that, I would definitely do that. Please wear a mask. There's a couple that's very close to our family, a husband and wife, and one of them got vaccinated and the other one didn't. One of them is in the hospital and was just moved to ICU today, and that was the one that was not vaccinated. So I can't tell you how important vaccinations are. But as we think about Lawrence and Douglas County as a community and protecting the ones that are most vulnerable and making sure that our students remain in school with no interruptions, let's please continue to lead the way as a state in terms of vaccination. I think we were down to third now. Let's move back up to that top spot because we have to protect our students. And I want our students so bad to remain in school this year. And so the more that we can do as a community, the better. So thank you all for having me on tonight.
Thank you all of you for those last words and messages. Is there anything else that you wanted to say, maybe related to questions, or you want to reiterate any of your past points, anything like that? Okay, well, definitely thank you to the audience for making time tonight to stay informed. We really appreciate being in a community where the people are interested in learning more information, and they want to, and that they trust us with their questions, that they want to ask their questions and hear our answers to them. We definitely really appreciate that in our audience and, taking the time to be here tonight. Thank you to our panelists for taking the time. Like I mentioned earlier, we are all working very hard right now, especially leaders within public health, local government, and local education. So thank you so much for all that you're doing. And then on top of it, being willing to spend your evening hours with us, going over questions and things. I know we have meetings about this all the time. Maybe we're sick of this information, but you're here to say it again for everybody and to answer new questions that, as the situation continues to change. And so we really appreciate your time, your energy, your expertise. Like I said before, we are going to follow up on any of the questions that we were not able to answer. Either they were received through our submission form too late, or they were here on our Zoom chat during the public Q&A. We have your email addresses because you had to register for this. So we'll reach out to you. I'm going to go ahead and save the chat now as well. So yeah, we will definitely be following up. We really appreciate Ruaa, I really appreciate you as well for helping to co-plan this. And we will definitely be having more material like this, whether it's a public panel again or just other kinds of materials in the future.
Thank you so much, Alex. Really appreciated co-hosting with you, and thanks for all the plans into this. Just really great discussion today.
Awesome. Well, we may adjourn. We're right at 7:30 too. Good timing. Wow.
Have a great evening, everybody.
Thanks, you guys.